Now, let's discuss about their different strain. So the first strain is the enterogenic E. coli. Okay. Another strain is enterohemorrhagic E. coli. Another strain is the enteroinvasive E. coli, then enteropathogenic E. coli, and enteroadherent E. coli. Now you may thinking there are so many the puzzling, you can say, name. How can you remember this name? Okay. So I'm going to use certain tricks to make you remember these things, because these strains we have to understand. There are, you can say, more than 150 strains are, you can say, present in the E. coli, but these are certain notable strain of E. coli which causes the diseases or different types of diarrhea in the humans. Fine. So let's discuss first enterogenic E. coli. Now, as the name suggests, they are the, you can say, toxin producing strain of E. coli, isn't it? So you see that there's a long name. So we have to minimize the name by using certain abbreviation. Fine. And their abbreviation is easy to understand, which you are already seen sometime in the book. So their abbreviation goes like this. First, you should write the normal capital E. Then focus on their characteristical part, that they are the enterogenic. Okay, enterogenic means they are producing some of the toxics. Okay, so here the T should be bit bolder. Okay, and now normal. E. coli stands for E and C. So normal E, normal C. Got the points? Now same goes for the enterohemorrhagic E. coli. Now you tell me, E normal, yeah, S should be bit bolder. Very good, because it's hemorrhagic, means it's produced, hem word is used for the blood, isn't it? So basically they produce which type of diarrhea? Inflammatory or non-inflammatory? First, inflammatory, very good. And inflammatory which type? Yeah, bloody diarrhea. So H should be bit bolder, very good. And then E normal, C normal. Fine. Now, the same goes for the enteroinvasive E. coli. E normal, I should be bit, you can say, bolder, then E normal and C. Now, it's same goes for the enteropathogenic. E normal, P should be bit bolder, and E and C. Now, about the enteroadherent E. coli, E is a normal because it's adhesive type. Its A should be bit bolder, yeah, and E normal, C normal. Got the point? Why abbreviations are used? Because abbreviations make, you can say, easy to conceptualize the things, as well as make the sense of, you can say, using the shortcuts, make the sense of using the shortcuts. And here, this abbreviation depends upon their characteristics, name, bold part. Fine, no problem. Now, come to the syndrome. Since it is an enterogenic E. coli, they are generally causing the watery diarrhea. Which kind of diarrhea? Watery diarrhea, which is basically a non-inflammatory type. So, if we talk about the enterogenic E. coli, they are producing the normal watery diarrhea. Okay, they are causing the watery diarrhea. Now, since it's producing the watery diarrhea, we can use the antibiotics. In the severe condition, remember, in the severe conditions, we are allowed to use the antibiotics. Now, we are allowed to use the antibiotics. Fine. No problem. Now let's move ahead and discuss about the second strain. The second strain is called as the enterohemorrhagic E. coli. Okay, and since it's a hemorrhagic, it causes the bloody diarrhea. It causes the bloody diarrhea. But here you should have to take the precaution about the antibiotics. You are not allowed to use the antibiotics normally. Okay, because of some of the possible hemolytic uremic syndrome. Fine. You are not allowed to use the antibiotics. So antibiotics are here not used, or there is a poor selective use of antibiotics. Fine. No problem. Now let's move to the another category. The another category is entero-invasive E. coli, and this entero-invasive E. coli, they are also causing the bloody diarrhea. Remember, hemorrhage word itself so that it will cause the bloody diarrhea, of course. There's no doubt. But invasive means it will penetrate the mucosal layer. It will invade the mucosal layer. Means it can also produce the bloody diarrhea. Easy to understand? Yeah? Bloody diarrhea. And generally for management of this bloody diarrhea, you have to go with the management of the fluid ions. Okay, fluid ion replacement. Okay, fluid ion replacement, and also called as the rehydration. Rehydration and rehydration. Rehydration. Okay, to prevent the dehydration which is happened due to the bloody diarrhea, as well as the fluid and ion replacement. Fluid and ion replacement. Fine, got it? No problem. Now, let's move to the another category. The another category is the enteropathogenic E. coli. These enteropathogenic E. coli, they are causing the persistent watery diarrhea. Okay, persistent watery diarrhea, and mostly in the newborn infants. Okay, persistent. If these are the acute type, means watery diarrhea are acute type, and this one is the persistent. Persistent and diarrhea. Okay, persistent diarrhea in the mainly affect the infants and others. No, this watery diarrhea which is happened due to enterogenic E. coli, and this is common in the westerns. This is common in the westerners. Okay, and they are also called as the, sometimes you come across the word traveler diarrhea. Which diarrhea? Traveler's diarrhea. Traveler's diarrhea, because a person and going from one region to another region, and due to the geographical changes, they acquire some of the pathogenic strain of E. coli, and they will suffer from the traveler diarrhea. Now the last type is the enteroadherent type. Okay, they are also causing the persistent diarrhea in the children. They are causing the persistent. Persistence means long-lasting diarrhea. Persistent in diarrhea in children. Fine, no problem. Now about their treatment, the same. You have to use the electrolytes. Okay, generally the electrolyte water solution, and you have to go with the dehydration. So this is about the strain of E. coli. Now once we discussed about the strain, now let's move ahead and discuss about their pathogenesis, or E. coli pathogenesis. Make the heading Pathogenesis of E. coli. Pathogenesis of E. coli. Now, the pathogenesis of E. coli is, you can say, we will take the first one strain example, enterotoxigenic E. coli. Okay, so pathogenesis of E. coli. Okay, which strain? Yeah, which strain? Remember, different strain of E. coli, okay, undergo different pathogenesis. Fine, but there are certain commonality between all those strains. So first strain which we are going to discuss, okay, that's called the enterotoxigenic E. coli. Fine, write it down. Which E. coli? Enterogenic, and this is a common type. Okay, this is a common type and most prevalent type, enterogenic E. coli. Now, you will see that mostly it's discomfort, mostly discomfort the gastrointestinal tract. Fine? Now, so we are taking up one part. Suppose bacterium is present. Now we ingested bacteria come into our stomach region. Okay, now we are enlarging this mucosal layer, and see what changes this bacterium causes. So this is a mucosal cell, okay? This is a mucosal cell, and you know that one cells communicate with another cell through certain gap junctions, certain ion channels, yeah? One cell interact with the external environment, extracellular environment through the ion channels. Now, this bacterium, okay, this bacterium endotoxin basically, suppose this is a enterogenic E. coli bacterium, okay, and it produces certain endotoxins. These endotoxins, they will bind with the one enzyme, they will stimulate one enzymes, okay, and that enzyme is basically responsible for maintaining the ionic inflow and outflow, efflux and efflux of ions, fine, thereby maintaining the ionic stability, ionic equilibrium. So this bacterium endotoxin basically disrupt one enzyme, they stimulate the one enzyme called as the guanylate cyclase, and this guanylate cyclase is responsible for changing the guanosine 5-triphosphate. Write it down. Guanosine 5-triphosphate. Okay, this enzyme guanylate cyclase. Which enzyme? Guanylate cyclase enzyme, which is stimulated by the bacterial endotoxin, and this enzyme is generally responsible for changing the guanosine 5-triphosphate into the cyclic guanosine 5-monophosphate. Cyclic guanosine 5-monophosphate. So normally this enzyme is, you can say, converting the guanosine 5-triphosphate into the cyclic guano-monophosphate and maintaining the ionic influx and outflux. But if it is stimulated by the external, you can say, agent like the endotoxin, which is produced by the enterogenic E. coli, then it will stimulate, and you can, there's upregulation of this enzyme, and thereby there's a more conversion, and due to this more conversion, the ionic stability will, it will, you can say, disrupt and result into the efflux of certain ions like sodium, potassium, bicarbs, water, and these all contribute to the diarrhea. Okay, it's about their pathogenesis. It's a simple pathogenesis about the enterogenic E. coli, fine. But there could be the other you can say pathogenesis, fine. So you should refer all those type. And just for your introduction point of view, I'm just giving, there are certain different toxins called as the hemolysin, okay, and verocytotoxin. Hemolysin and verocytotoxin are two other different type of toxin which will, you can say, bind with the different types of enzyme and disrupting basically the ionic flow. Now, what can be the characteristics, sign and symptom, the clinical manifestation? One of the clinical manifestation is that there is a diarrhea, okay? So watery stool. Now you may thinking, where is our immune system, a body part of our cell, what they are doing? They have no any use, Generally, you can say there is no any higher immune cells involved in the, you can say, E. coli pathogenesis, okay? But E. coli have to face the action of our, you can say, stomach acidity, a gastric acidity, okay? So gastric acidity, apart from that, certain immunoglobulins like IgM, IgG, these immunoglobulins, these antibodies is very much responsible for, you can say, minimizing the pathogenicity of E. coli. So generally, the baby who are immunocompromised or not getting the proper these antibiotics, they suffer a lot from the neonatal, you can say, meningitis, a secondary disease which we are going to see. So one of the signs and symptoms is the watery stool, and due to the watery stool, there is a weakness because fluid volume is deficient. So weakness are there. There is the stomach abdominal cramps. Yes. abdominal cramps because of the loss of the iron. Okay, the pain receptors are stimulated, so there is the abdominal pain. Apart from that, there is the nausea and the vomiting. Okay, nausea and vomiting, generalized pain, malaise. Okay, so these are certain sign and symptom or clinical manifestation. Now, laboratory, generally the fecal is taken as a specimen, okay, and it is grown to the agar plate. Which agar plate? McConkey agar plate. McConkey agar plate for detection. But generally, light microscopes are not, you can say, appropriate microscope to see their pathogenic strains, because their pathogenic strains are very, you can say, very small as compared to the normal strain of E. coli. Remember this thing in your mind, okay? And about their treatment, as I said previously, there is a symptomatological management. Yeah, you have to go with the rehydration, a fluid replacement therapy. Okay, fine. Apart from that, breastfeeding. Okay, there are certain research which shows that the baby which are, you can say, feeded by the breast, okay, they have the less diarrheal episode as compared to the non-breastfeeded, you can say, babies. Fine. So breastfeeding is, you can say, here they are highlighted. Apart from that, there is the oral food and electrolyte therapy. Okay, and antibiotics are not recommended, but during the severe condition, antibiotics should be used. And we have to prevent the transmission. Okay, so preventing the transmission, you have to adopt the sanitation, a good sanitation. Okay, sanitation means maintaining the hygienicity, you can say managing the waste properly. Fine. So all these things, and just because of the lack of the sanitations, a person suffer a lot from the E. coli, because generally the E. coli are not pathogenic, they are a part of our normal flora. Now, about their extra-intestinal diseases, okay, extra-intestinal diseases, you should remember, write it down first, the extra-intestinal diseases. Now, the extra-intestinal diseases, okay, these extra-intestinal diseases, they are different types. So, first, and remember, the E. coli are one of the most causative agent of the urinary tract infection, UTI. So UTI is caused by the E. coli commonly. First point. Second point, you have to remember, it causes the inflammation of the bladder, and the term which is used for the inflammation of the bladder is called as the cystitis. Fine. And it can also causes, you can say, inflammation in the nephrons or the kidney, called as the pyelonephritis. Yeah, called as the pyelonephritis. Fine, no problem. Now, apart from that, if it goes to the higher system, central nervous system, it causes the, if we talked about the central nervous system, it causes the neonatal meningitis. Neonatal meningitis means inflammation of the layers like the dura mater, Maya matters, okay, arachnoid matter. These are the certain layers, or you can say all the layers of the central nervous system which become inflamed due to the spread of this bacterium into the their respective space. Fine. Apart from that, sometimes during the hospitalization, patients acquire this bacterium, the infected strain of the Salmonella, and that result into the bacteremia, okay, bacteria present in the blood, fine, called as the endotoxic shock as well as the pneumonia. So pneumonia, endotoxic shock, and bacteremia, also called as the sepsis, these are also the extra-intestinal diseases caused by the pathogenic strain of E. coli. Fine, no problem, understood. So let's conclude today's lecture. What we studied? We studied the second bacterium called as the E. coli. Okay, it's a part of our normal clone, normal microflora which is present in the colon region. But there are certain pathogenic strain which causes the different diarrheal diseases that can be managed by the, you can say, food replacement as well as maintaining the ionic, you can say, equilibrium. Antibiotics are not used, not, you can say, limited use because of their antibiotic resistant, but in the severe condition there is a use of the broad spectrum antibiotics. We've seen the different strain of E. coli. Okay, we discussed the one of them, detailed pathogenesis, that's called the enterotoxigenic E. coli, which is called as the watery diarrhea, or also called as the traveler diarrhea. Fine, no problem. We've seen their characteristics. They are a gram-negative bacteria, okay, bacillus shape or rod shape bacteria. Okay, we've seen their lab detection. We can, you can say, grow this bacteria on the McConkey agar plate, and it will appear as a pinkish color. Their colony appear as a pinky color. We've seen their clinical signs and symptoms. Okay, generally this different strain of the E. coli produces the two different types of you can say the diarrhea. The one is called as the inflammatory diarrhea, another one is called as the non-inflammatory diarrhea. Understood? The inflammatory diarrhea produces the bloody, you can say, diarrhea. Non-inflammatory diarrhea will produce the watery diarrhea. We also seen about, you can say, their morphology, both their antigenic morphology, their general morphology, as well as we seen their colonical morphology. Fine. I hope you understood today's lecture. So thank you for having me. Bye. Have a nice day.